Hi everyone, welcome to the channel. If you're new here, we explore medical topics and lifestyle. In this video, we're going to be talking about gout. So we're talking about what gout looks like, what to expect when we are going through symptoms, how to prevent it, as well as triggers and complications of it. So what is gout? Gout is a type of arthritis that causes sudden and severe joint pain. Why does it actually happen? Well, it happens because we have too much uric acid in our bodies. Now, I'll make another video on all the reasons why this can happen, but essentially, there's a few. So, you can have too much uric acid in your body can have a tough time excreting it, and so on. Essentially, what this uric acid then does is it forms crystals, and then these crystals deposit into our joints, and then they cause the inflammation and the swelling and the pain that we experience when we're having a gout attack. Now, what usually happens is we get a sudden and severe pain in a joint. This usually happens in a big toe, but it can be in other joints, such as your feet, your wrists, your hands, your elbows, and your knees. And generally speaking, the joint is hot, swollen, and it's red at the skin over the affected joint. An attack of gout usually lasts between 5 and 7 days, then it gets better. It may not cause lasting damage to the joints if you get treated for it. These symptoms that we listed, they may cause you to reach out to your doctor and get a bit of help. But if any of these urgent things start to happen, then you absolutely must reach out to a doctor to get a bit of help. These includes pain that is getting worse. If you start to get temperatures, so if you start to feel hot, cold, shivery, and also if your appetite's severely affected, right? If you start to feel sick or you can't eat. At your appointment. So what happens at your appointment? Let's say you're having a hard time with symptoms and you need to speak to somebody, you need to see somebody. So what happens at your appointment? Your doctor may ask about your diet and if you drink alcohol. Your doctor may also ask you about certain lifestyle things that may be going on with you. Your doctor might request a blood test, right? So a blood test will find out how much of a chemical called uric acid there is in your blood. We spoke about this at the beginning of the video. Having too much uric acid in your blood can lead to crystals forming around your joints, which cause pain. Your doctor also might refer you to a specialist called a rheumatologist if they're not managing to get it under control or if we're having a lot of symptoms or really, really struggling. But before seeing a specialist or anything like that, your doctor is going to examine you, take a history, do a blood test most likely, and manage your symptoms. How is your doctor going to manage the symptoms? So, attacks of gout are usually treated with medication, first and foremost. So, something like NSAIDs or non-steroidal anti-inflammatory medications. So, you've probably all heard of something like ibuprofen, for example. That's what's taken first line. Then, second line therapy, or if it's not settling down, then we move on to steroids. Steroids are a potent medication that can help reduce pain and swelling. So that's generally what the number one and number two things that the doctor is going to do in terms of managing your symptoms and giving you medication. Now, what's equally important, or if not even more important, is what you yourself can do to try and manage your symptoms. There are things that you should do and the things that you shouldn't do. So things that you should do are to take the medication that's been prescribed as soon as possible. It should start to work fairly quickly within a couple of days. So hopefully we're going to get on top of those symptoms pretty soon. Rest and raise the limb. So rest and raise the big toe in most cases. Keep the joint cool. So apply an ice pack or a bag of frozen peas, wrapped in a towel, for example, to 20 minutes at a time. Drink loads of water, obviously, unless, for some reason your doctor told you not to. And try to keep bedclothes off of the affected joint at night, just to not irritate it furthermore. And then the things that you shouldn't do are to aggravate the joint, right? So don't put pressure on the joint. Sometimes you try your best. You're doing everything you can. You're trying to prevent any attacks. You hate the symptoms, but it's not working out, and you're getting symptoms. So gout can come back every few months. Sometimes it can take years, but it can come back. And if it's not treated, then it can cause trouble, like we mentioned earlier on. If you have frequent attacks or a really high level of uric acid in your blood that we checked for on the blood test, you may need to take uric acid lowering medication, right, to prevent further attacks. It's important to take this medication, if you are taking it, regularly, right? So even when you don't have any symptoms, you still need to keep on taking it. I just mentioned how you can try your best to prevent symptoms from happening. So these are the things you can do to prevent gout from coming back. Oftentimes, making lifestyle changes may mean you can stop or reduce further attacks. Recommendations advise to get a healthy weight, right? But avoid crash diets. So simple, healthy weight. Also, eat a healthy, balanced diet. Have alcohol-free days each week, or try not to drink. Drink plenty of fluids, right, to avoid getting dehydrated. Exercise regularly, but avoid intense exercise or putting a lot of pressure, especially on those joints. Stop smoking, and some doctors may talk about vitamin C supplements as well. And then there are things that you shouldn't do. So not necessarily things that are going to absolutely trigger an attack of gout, but definitely things that won't help, and can also appear like triggers at times. So don't have lots of sugary drinks and snacks. Don't eat a lot of fatty foods, and don't drink more than 14 units of alcohol a week generally. So if you are drinking, try to spread the drinking over 3 or more days, if you drink that much. And now triggers. So some of them are in your control, some of them are outside of your control. And hopefully through lifestyle management, we can try to minimize the chances of triggering gout. So you might get an attack if you have an illness that causes a high temperature, if you drink too much alcohol or eat a very large fatty meal, if you get dehydrated, if you injure a joint, or if you take certain medications as well, which we'll cover in another video. To really reinforce the point about lifestyle and prevention, there are certain groups that are more predisposed to getting gout. So gout sometimes runs in the families. It can be more common in men, especially as they get older. You might have a higher chance of getting gout if you are overweight or obese, if you drink alcohol, like we mentioned, have been through the menopause, if you take certain medications, like we mentioned, things like water tablets and so on. If you have high cholesterol, high blood pressure, kidney problems, diabetes, osteoarthritis, and if you've had any kind of trauma or surgery to an injury. And finally, why are we doing all this? So why are we trying to manage gout? Why are we, focusing on a healthy lifestyle, sometimes giving medication, doing blood tests, and all of these things? Well, it's because there can be complications. So it's rare to get lots of attacks or chronic gout because we generally get on top of it. But if you do, it can damage your joint. Chronic gout can also cause tiny white lumps called tophi to appear under the skin. This is usually on your ears, fingers, or elbows. And this is where urate crystals form under your skin. They can be painful, which is not good. You can also get kidney stones if uric acid levels are very high. So you'll need treatment to reduce the levels. And that's pretty much it, guys. So that was an overview of gout, what to expect kind of when you go to the doctor's office, why it's important to manage it, and so on. We'll have another in-depth video on gout where we get into a little bit more detail, but that's it for now. Like and subscribe for more, and we'll see you in the next one.